Hi guys, I'm Dr. Alessia Roehnelt, double board certified endocrinologist, and on my channel, I help break down complex medical information into bite-sized pieces that you can understand so that you can learn more about your body, how it works, and whether or not to believe any of these myths that are out there. And today we're going to be going through some of the basics about thyroid disease. Now, a lot of patients come to see me because they have an underactive thyroid, maybe they have an abnormal thyroid test on blood work, or maybe they have normal blood work, but they just don't feel great and they're looking for answers. So let's start with the basics. What is a thyroid? The thyroid gland is an organ that sits at the base of your neck. The thyroid, I like to think of it as kind of the pace of your body. So if your thyroid is going too fast, is making too much hormone, a lot of things in your body are going to be sped up. For instance, your GI system, you might have increased bowel movements or diarrhea. You might have a fast heart rate. You might feel very anxious or jittery all the time because everything's moving a little bit too fast. Versus if you have an underactive thyroid or hypothyroidism, then everything's kind of moving too slowly. You might feel very tired and sluggish. You might have a lot of constipation. You might feel really cold all the time or have very dry skin. So the thyroid gland basically controls the pace of your body. And if you're making the right amount of hormone, that pace should be good. If you're making too much, you go too fast. If you're not making enough, things will go too slowly. Now, the thyroid gland makes two hormones, T4 and T3. Most of what it makes actually is T4. About 90% is T4 and about 10% is T3. When we have a patient who has an underactive thyroid gland and we need to give them some thyroid hormone supplementation, we generally start with giving T4. That would be medications like levothyroxine, Synthroid, Levoxyl, etc. What's interesting though, is that even though the thyroid's mostly making T4 and we give patients T4, the active hormone in the body, the one that makes you feel good, the one that gives you energy, the one that helps you with focus and thinking clearly, is T3. T3 is the active form of thyroid hormone. So why do we give people T4? Well, there are several places in the body, in different organs in your body, where T4 hormone is converted into T3. And theoretically, the same should apply for medication. You should be able to take that T4 medication and convert it into T3 hormone, and you should be fine. But not everybody works that way. We do find that sometimes there are people who are slow converters, either of the medication itself or their own thyroid hormone. Sometimes we find that people aren't able to get adequate T3 hormone across their blood-brain barrier. So we look at blood work, the T3 level is normal, but they're not able to get it to their brain. So they're not getting that benefit. They still feel fatigue. They still have memory issues, concentration, all of that. So while most patients will be okay just taking T4, there are a select amount of people who need an additional T3 hormone to help them feel their best. Now, despite working with T3 and T4 between hormones and medications, those are actually not the numbers we look at to make treatment decisions. We look at a totally different number that doesn't come from your thyroid. It actually comes from your pituitary gland. Your pituitary gland is a super small little gland about the size of a pea, and it sits right behind your eyes but in front of your brain. The pituitary gland is the command center for hormones in your body. It tells your ovaries how much estrogen to make. It tells your adrenal glands how much cortisol to make. And it tells your thyroid how much thyroid hormone to make. That number is called your TSH, thyroid stimulating hormone. So it comes from your pituitary gland and it's the signal to tell your thyroid how much to make. This TSH number serves as your body's barometer for how much thyroid hormone you need. For instance, if you're not making enough thyroid hormone, or if maybe you're not on the right dose of medicine, the dose is too low, your TSH number is going to start to go up because it is yelling at your thyroid, come on, stimulate, make more, we need more. The blood work is inappropriate, the levels are too low. So your pituitary gland will tell your thyroid how much to make. It'll start going up and up and up, saying we need more, we need more. So when we in the office see patients who have a high TSH, we know that that's because their thyroid gland is not providing enough thyroid hormone for them, or their dose of thyroid medication is too low. Alternatively, if the thyroid is going a little too fast, doing a little too much, or maybe a patient's on too much medication, that signal's going to go down because it doesn't need to keep stimulating your thyroid. There's plenty of thyroid hormone in the system, so it doesn't need to keep rising and going up. And in fact, it might even be on the low side because it doesn't want any more thyroid hormone to be stimulated or produced. Now, in an ideal world, the TSH is just normal. It is talking to your bloodstream. It's saying, okay, we're getting the right amount of hormone. We're not getting too much. And it's right in the middle and it's perfect. And that is the reason why most people will check sometimes only a TSH number, because it truly is the barometer for, is that person seeing enough thyroid hormone? However, when somebody comes in with a normal TSH, but symptoms of a thyroid issue, that's when we might need to dive a little deeper and look at some of these other hormone levels. Some of the symptoms I'm talking about with having a thyroid disorder, we kind of addressed a couple minutes ago. If your thyroid is going too slow, you're not making enough hormone, you're gonna feel like you are just walking through mud. You're gonna be tired, you're gonna be sluggish. You're going to have slower bowel movements, so maybe constipation. Your sweat glands aren't as active, so maybe you're getting dry skin. Some people talk about concentration issues, memory problems, brittle hair, dry nails, changes in nails. These are some of the classic symptoms of hypothyroidism. And sometimes we even see weight changes because the thyroid gland also affects your metabolism. So if your metabolism is moving too slowly, you might start to gain weight. And alternatively, if it's moving too quickly and your body is seeing too much thyroid hormone, all of those things are going to be sped up. So your metabolism is actually going to be going really fast and you might even lose weight. You might even notice your appetite's going up. You're eating more than ever, but you're losing weight. Or you don't have dry skin. You actually have very oily skin. You're sweating a lot more than normal. Even your body temperature can go up a little bit where you feel hot all the time. Your heart's going fast. You might even feel shaky because it's almost like you just drank 10 cups of coffee. Like you have this surge of energy, this inappropriate surge of energy. And that's where you might have an overactive thyroid. If a patient has abnormal thyroid levels or maybe normal thyroid levels, but they have symptoms that either they or their physician feel could be attributed to the thyroid gland, that's when a consult with an endocrinologist is very appropriate. Some people just start with an endocrinologist, which is fine, especially if there's a family history of thyroid disease, because it is often very genetic. But many other people will say, okay, let me talk to my primary care doctor first. And if they feel that this is something kind of out of their realm of expertise, or we don't quite have an answer because all the blood work is normal, that's where seeing an endocrinologist can be very helpful. I see patients in my practice all the time with these types of symptoms and issues, and I'm happy to help them and address some of their concerns. Let's talk about medications for a second. The standard medications that we prescribe are T4 hormone. The generic of that is called levothyroxine. The brand names, some of the most common would be Synthroid, Laboxil, Unithroid, or Tirosint. These are specific companies that make formulations of levothyroxine. I often start patients on the generic medication because honestly, most people do just fine on the generic. I myself take the generic levothyroxine and I have for a couple decades at this point. But there are people that may have certain sensitivities to these medications, or they don't absorb the medications as well. And that's where going to a brand might be a little bit more helpful. But normally I start my patients on the generic. And if, despite getting normal thyroid levels, the patient still has symptoms of being hypothyroid, that's when we will try giving T3 hormone. T3 hormone is going to come in the form of generic liothyronine or brand Cytomel. This medication can be dosed either once a day in the morning or sometimes twice a day, once in the morning and once in the early afternoon, because T3 hormone is in and out of your system quickly. It really reaches its peak in about 6 to 8 hours, and then it's really starting to trend down at that point. So some patients do need it twice a day so that they can kind of get through the entire day with a good amount of T3, although some people really only need that surge in the morning. T4 hormone, on the other hand, like levothyroxine or Synthroid, that actually lasts a very long time in the body, 7 days or more. That is important because if you are on thyroid medication, you may have seen a doctor once who told you to skip a pill once a week or take 2 pills once a week. And for many medications, to hear something like that sounds a little bit crazy. Why would I skip a dose, skip a day, double up? It's because this medicine lasts so long in your body that we're actually able to average the dose over the course of a week. So doubling up is sometimes a way to go up on the medicine without completely changing the dose. Skipping a day is a way to slightly go down on the medication without lowering the dose. And sometimes if a patient misses their dose in the morning, they can actually double up the next day. And it's all washing out to about the same amount of thyroid hormone in their system. So it's certainly a unique medication and unique dosing that doesn't quite match up with really anything else that we have. I hope you found this helpful. And if you have any questions about thyroid disease and you want to know more, please let me know in the comments. And of course, make sure to hit subscribe so that you never miss another episode. See you next time.